So we're going to show you a really quick video, and I really hope it helps some of you guys out. Recently, one of our snakes has not been acting himself like at all. He's super friendly. He's not being aggressive or nothing, but you can tell he's just like not himself at all. He hasn't been feeding, so I've been constantly checking him, checking his temperatures, checking everything. Everything's perfect, but he just didn't seem himself. So we actually opened up his mouth to check if he had any signs of RI, because there was no signs to the naked eye about opening up his mouth. There was no mucus showing or anything, but when we actually opened up his mouth, you could see he did actually have RI. I don't know where I picked it up from, if I've picked it up from somewhere or whatever, I don't even know, but I would have definitely passed them for all of our snakes, because I handle, as you probably know, I handle all my animals, and I definitely passed it from one to another, so they're actually all going under treatment now for RI. But I think it's so important that we just, everyone, me, you, whether it's lizards, anything, you always, as soon as you get them out, you check that they look healthy and things like that. But I think it's really important for you to watch this, and if you don't know how to open up their mouth, we'll show you actually how to open up their mouth so you can check at home too, because if you can catch it early like we did, it's very easy to fix. I went to the vets, but because it's actually all three of them have it, they've been generous enough to actually give us the antibiotics to do at home rather than loads and loads of money, and obviously consultations. They were kind enough to see them all individually first to check they definitely had it, and then let us do it from home itself. And if you watch this video, it's always good just to open up their mouth. It doesn't hurt them at all, but it's just nice to know. And then again, if you ever did pick up an RI or anything like that, then you can catch it nice and early, and it's really easy. I was a bit worried about vet bills and things like that, but the actual antibiotics is, I think it's about £4 a syringe, so it's just really worth the knowledge. So I hope this helps. Gilbert's having his final injection today, and the other two only have 2 left. I'll show you in this video. The mouth is pretty much cleaned up now. It is just a bit of mucus, but we'll talk you through it anyway, and I really hope this helps. Thank you.
We're going to show you how to check for RI so that you guys can do it at home. What you want to start off with doing is just gently get your snake, just, if you hold it like that, and then just get right behind those 2 head bones, like so. Do it quite gently but firmly, and then you want to get a cotton bud. Make sure you don't get any cotton in the mouth. Just use the plastic bit in the middle, and just slowly and gently open your snake's mouth. And then, as you'll see, this one has actually got a little bit of RI. What you want really when you're checking for it is there to be no saliva at all. But if your snake does have a respiratory infection, then you'll see a bit of saliva. His mouth looks a lot better now, that's only because he is going through the treatment, and we are going to show you how we do our treatment at home. But obviously did take them to the vets, so it is proper veterinary treatment, and it's all advice from the vets. See, this is from the vet, so it's all measured out. It's just this needle. You want to do it just on the lower back, just on the right or the left side of the spine. There's a bit of fat, and you just want to put it in. Get it out like that. You can see there's no blood, and then I'm just pushing it slowly in. So now what I'm doing is just sucking up, making sure there's no blood, and then pushing it in really slowly.
So in this video, thankfully you can see our snakes are very tame, so it is quite easy for us to do it. If you got like a different snake or a more aggressive snake, then obviously it's not going to be quite as easy to just get out of his head like we do. But when we first looked and opened up his mouth, we didn't actually, I personally didn't actually know like next to nothing about RI. It is very contagious, hence why I've actually passed it between each and every one of the snakes. I'm sure it would have just been one that had it to start with. One of them's actually new, and I did actually have another new snake, what turned out to be a male, and I thought it was a female, so I don't still actually have that, but I've had a couple new snakes recently. Rachel's constantly in contact with multiple snakes, so I don't know where we've picked it up from. Well, it could have very well been something that I'd done. Maybe cold side might have got a bit too cold, who knows, but either way, everything's perfect now, and they're going through treatment. When I first looked up on the internet, there was all these different sort of home remedies, how you can do it with vapor rub, and F10 and things like this, but I personally just wanted to do it properly with the antibiotics from the vet. Then I know for sure it's 100% finished and done. There's no risk of it coming back, or whether it's definitely gone or so on. It's a full treatment. The reason you might be a bit squeamish, but the reason I actually wanted to show you the actual injecting itself is I don't want you guys to be worried about getting RI or trying to look for RI. I'm trying to make it as nice as possible and show you how easy it is to really open up their mouth and see how easy it is to check yourself at home. And in worst case scenario, if it does have an RI and you're like myself, you don't want to do the home remedies, you just want to know it's definitely done, then take it to the vets. The actual injections aren't going to cost you much, and you can see from the video, it isn't hard to do it from home, and it's done and dusted, so don't be fearful. And I really hope you at home can learn from what I'm going through at the minute. It's no burden on me, to be honest. I'm just glad that I caught it as early as I did. So I just want to pass this information over so you guys can do the same at home, hopefully.